only dog owners.
Sorry, I got a house full. I'm trying to prevent dogs and kids, but
we got 2 kids and a German Shepherd.
telling you.
All right, let me make sure that we are live. 1 second. There we go. We are live. Okay. I am meeting all these people that are in the waiting room. Okay, thank you everyone for joining. My name is Carmen Martinez. We are on our weekly discussion of Tuesday Talks. If you guys have registered, the ones that have registered, if you can put your video off and mute your video so we can just have the panelists talking. So today we have some amazing panelists that are doing amazing things within our community. January is Human Trafficking Awareness Month. So this is going to be a time for you guys to ask any questions. Feel free to put anything on the chat, and also feel free to put anything on our Facebook Live. I will be responding to that. So I'm going to introduce our amazing panel that we have. We have Dr. Mollie Gordon, Ms. Cathy McGibbon, and we have Noah and Aliyah Keyless. So I'm going to start with Dr. Mollie Gordon. Tell us who you are, and then we'll go with Cathy, and then Noah and Aliyah, and then that way we can get to know you guys.
Hi, thank you, Carmen, for having us all today and for bringing attention to this very important topic. My name is Mollie Gordon. I'm a psychiatrist at Baylor College of Medicine. I'm clinical faculty where I teach medical students and residents, and the medical director of an anti-human trafficking program that provides education to healthcare professionals, a clinical model of care where we consult and evaluate the mental health needs of trafficked persons, a research and writing arm, and then a advocacy and policy group. So thank you for having us, and we're glad to be here.
And we are we next?
Go ahead.
We are.
Oh, hello. Sorry about that. I think we might have jumped the line. I apologize. Catherine, Mollie, Carmen, and everyone who's joined us tonight. Thank you for joining us. My name is Noah, and this is my wife, Aliyah Keyless. We are up our studio with the program called Mini Murals, where we paint the traffic signal control cabinets or the art boxes that are all over the city. And our mission is really simple. It's civic pride through civic art, where we hope to educate, move, and engage people, utilizing the psychology of color to make people happy. That's our mission, you know, putting art in unexpected places. And Elia and I were asked by Council Member Cisneros to curate boxes in high traffic areas of the city of Houston. When I say traffic, I'm not talking about driving traffic. I'm talking about human trafficking, and all that is reported through that. So anyway, yeah. So that's who we are, and why we're here. Thank you.
Thank you for having us.
Thank you. And Ms. Catherine McGibbon.
Hey, I'm Cathy McGibbon, and I am super excited to be joining with one of my favorites, Dr. Mollie Gordon. I'm always like excited when I get to like be on a panel with her, and super interested and excited about these murals, Keyless family. So would love to hear more about that. I'm a survivor leader and advocate here in Houston, and I've just been in the space of anti-trafficking for the last few years since I overcome it myself, and just really passionate about educating the community, going a little further than awareness, and really just getting involved in some prevention and education and action-oriented, solution-based initiatives here in Houston. So I'm always excited to grow our partnerships and against the fight against human trafficking.
So once again, thank you everyone for joining. My name is Carmen. I'm Director of Development here at NAMI Greater Houston. And we want to focus today's conversation on Human Trafficking Awareness Month, which is the month of January. We want to thank also the Houston chapter of the Links. They were the ones that kind of collaborated with NAMI Greater Houston to really just bring awareness to this topic, which is a modern day form of slavery, which is human trafficking. Victims of human trafficking are suppressed and they are very coerced. they're forced into labor services. So it's very vital for us to expose our community to these dangerous and serious disrespectful form of labor. So today's panelists are going to be covering a lot of different topics. They're very involved in this cause. And then we're also going to be talking about any questions that you guys may have, or any comments you might have. Please put on the chat and also put it on our Facebook Live comments. The Houston Chapter Links is committed to being a voice to amplify the social injustice and is dissolving healthy relationships and any individuals when it comes to mental health and emotional stability. So we're very proud to collaborate with today's discussion with NAMI Greater Houston and the Houston Links. So we have a question. We're going to start with Dr. Mollie Gordon. Being in the mental health profession, how do you define human trafficking for our audience? And what can people learn what that is in our society?
I had to unmute myself. Thank you, Carmen, for that very important question. Some of the things we like to discuss when we talk about trafficking is differentiating it from what it is not. So often when I tell people that I work in human trafficking, their first thought is that I work in human smuggling and in addressing the mental health needs of persons who've been smuggled. And while patients who are trafficked may be smuggled, that doesn't always occur. The majority of our patients that we see are trafficked domestically here in Houston. Almost 90% of them are domestic. So to keep in mind, trafficking is a crime against a person, whereas smuggling is a crime against a border. And though they may overlap, they are very mutually exclusive. Additionally, when we talk about trafficking, trafficking has a lot of typologies. So there have been described 25 different types of trafficking, but in general, we separate them into labor and sex trafficking. And what that means is that another person benefits financially or in other forms of a commodity from the exploitation of the person being trafficked. And that's important because it often gets confounded with things like prostitution and sometimes other activities such as drug smuggling. And while some of these other activities may be illegal, what trafficking is it's the force of legal or illegal activity. So those are some things we like to differentiate what trafficking is not. So trafficking is we call the act, the means, and the purpose. So the act is by harboring another person for with force for some sort of means, whether it's labor or sex. And so when we think about trafficking, that's what we're addressing in our clinic.
Thank you for that thorough answer. I think that's definitely, a lot of people can get confused with just kind of the definition of it. We have another question that is for you, Mollie. Can you tell us exactly what you do in helping victims recover from being trafficked?
Well, we definitely can't do it by ourselves. And so when you say, what do? I'm actually part of a very large team of persons. And so I would answer that question with what we do. And what we do is we address trafficking from a public health response. And traditionally, trafficking has been evaluated in a federal manner from a prosecution arm, meaning prevention measures and outcomes have to do with stopping trafficking as a crime. And we're not interested in doing that. Of course, we don't want trafficking to exist, but we're interested in looking at trafficking from a health and harm reduction model and a public health lens, which means our interests are in primary prevention. And we work with partners in law enforcement and partners in the NGO space and partners in outreach, such as Cathy McGibbon's work and other partners in the city who are interested in educating persons to prevent trafficking from happening to them, and then educating healthcare professionals to identify trafficking as it presents to hospital settings. We do know that up to 88% of trafficked persons see a healthcare provider while they're being trafficked, and we estimate that this that this model of care may be able to reduce harm. Our patients are evaluated for their medical needs, their psychiatric needs, and their social needs through what we call a consult liaison model, which means They are seen in real time by our team, and then they're triaged for a safe discharge plan or a safe management plan. And that often includes partnering with community programs, whether it be case management programs such as the Landing, or shelter programs such as Salvation Army, rehab programs such as Santa Maria. It also may mean that the patient returns to their home environment, and we offer wraparound services, which is social, mental health, and medical services for persons to improve their outcome, prognosis, and reduce harm over time. Not all of our patients are trafficked while we see them. Some of them are childhood survivors, some of them are adult survivors, and some of them have more than one type of trafficking that they've experienced.
Thank you for that. I want to jump into Noah and Aaliyah. What are your murals conveying about anti-human trafficking activism? And can you just tell the public, how does that even come about with the partnership with the city of Houston? And what was the inspiration when it comes to some of these murals?
Well, Carmen, again, thank you for that question, and hearing Dr. Mollie Gordon speak. You know, it is a daunting situation. It's an unseen problem that's right in front of us, and we had no idea.
And so the council member Cisneros for District H actually reached out to us to say, you know, I recently found out about, you know, some initiatives that the mayor's office of anti-human trafficking and domestic violence are doing. And I thought that, you know, I love your program so much, and I love that so many people see it, that maybe we could do something to inspire hope, you know, or something like that for people who are in those situations that might come upon these boxes.
And so we know that, you know, we you know, we're not out there doing preventative stuff. So we then have a book of renderings and artists that were selected just for art's sake. And, you know, again, you know, I opened up, you know, you hear me say this, our mission is civic pride through civic art, where we educate, move, and engage people through the psychology of color to make people happy. And what we did, working with the mayor's office and getting special permission from Public Works and Engineering, we were able to put the National Anti-Trafficking Hotline number on there.
On these 4 boxes. And so essentially the council member chose, you know, she narrowed it down to about 10 designs that she thought were appealing and kind of like beautiful. And so then we did an online survey to members of the community, and we had almost 200 responses, which was really popular. And the top 4 designs that were chosen were the ones that got painted. And they chose the locations based on 311 calls, you know, 311 data of where, you know, people are calling in, not necessarily human trafficking, but they're calling in illegal, high illegal activity. Usually it's, you know, drug use, it's prostitution, and those types of things. So,
well,
so those,
not to throw labels out there, but yeah.
So yeah, so that's how those locations were selected.
Yeah, that was actually one of the comments and the questions that just came through on how were those, you know, where were those selected and how was the process? So thank you for answering that. So I'm going to jump over to Ms. Cathy McGibbon. You're a survivor and an overcomer when it comes to this. Can you explain to the public how did you come about or overcome that situation?
Sure. So just for the sake of time, I won't go through the entire thing because it's like a movie and we'll be here forever. But I did get out of the situation. I was in it. I was trafficked my early adulthood at 21. So and I was out there for the whole process. Took about 2 years from grooming to the point of my exit. And healing looked like to me was just really getting back into society and mocking people around me. That is literally what happened for me, because I didn't know how to explain what happened to me because of the trauma. I just couldn't articulate, okay, this is, you know, I really thought that I was just in a bad relationship and I wasn't going to tell anyone. I felt stupid. I felt humiliated that I let this guy kind of trick me into whatever he wanted to do. I had no idea that there was a label. I had no idea that this thing was a crime called trafficking. While I was out there, I didn't learn about trafficking until I was actually healed, you know, on my journey to healing. So literally I just suppressed it and I started, you know, looking around at my community members and saying, okay, well, that looks normal. Let me try to act normal. Let me try to speak like that. Let me, the people at school, go back into school and speak like them and, learn to be a mom. So because there was no services back then, I wasn't aware of any. And so for me, it was just literally just diving back into society and trying to overcome. And then I started journaling because I figured my journal was the only person that was going to believe me, because I just couldn't understand this surreal experience that I'd been through. I was basically, when I got out, I was completely like mute to that situation. I suppressed it so far deep, and I was just, it was just there. But my journal helped me. So I was able to just, document some things because I had to get it out some kind of way. And that journal became a book, right? And then that book became a stage play. But in the process of that, I was able to share my story with individuals that, had certain behaviors, or they may have been, in a rocky relationship. And I just thought I was sharing like, hey, I got out of it and I was in a bad relationship too, and you can get out of it. And then I realized the impact that had. I realized that more and more people were starting to say, oh my gosh, I think that happened to me, or something similar happened. And so that really kind of propelled my healing journeys, when I realized that, oh gosh, this is a real thing and people need help, and in an effort to prevent people from the long drawn out healing journey that I had to go through, I jumped right in, educated myself, and got a hold of some partners and figured out what this thing was. And I can tell you right now, restoration for me is a lifelong process. So I'm still on this journey. I tell people that one day at a time is just one step, one day away from my experience, right? So I can literally just turn around, and if I have a bad day, I'm at risk for going back there. But literally, it's a daily fight, a daily struggle, a daily decision to overcoming. So when people say, well, how did you get to where you are, and how did you heal? I wouldn't say heal. I would say I'm healing.
Exactly. So let me ask you this, for a lot of young people that are watching out there as well, how does someone get lured into this? What are some of the signs, or what can we teach others so they don't get into this situation, looking back into your experience?
Yeah, there are a lot of ways. And, one of the main misconceptions, because of, thanks to media and movies and stuff like that, one of the main misconceptions is that it happens through primarily force, meaning you're kidnapped, you're abducted, and then this happens, right? Or you're coming from the border and they're going to tie you up and they're going to throw you in a cage, and that's going to happen. I'm not discounting that. That does happen to individuals, but most of the time, it's through a trusted individual. Most of the time, victims know their trafficker. They've built a relationship with them. This trafficker, this perpetrator, this pimp has gained their trust of their victim. And so it's a process of seduction. Some people call it the grooming process, right? So they're getting to know you. They're getting in your life. They're gaining your trust. And these people they act like friends. They act like friends. They act like romantic partners. They can look like anything. Sometimes it's family, right? A cousin, a mom, a dad. It can be, there's so many factors to this, right? So I think, just really debunking that misconception that it's just only through abduction and only through kidnapping and only through the border. Once we shift our mind from that and realize that, hey, like this can actually happen to me. The things that I often say is that trafficking doesn't target necessarily people, it targets vulnerabilities. And if anyone's ever been vulnerable at any given time, then we can be all at risk if we're not aware and educated on how to prevent it. And so there are a ton of signs and red flags that I'm sure that we can all, go into, but I really wanted to get that point across, that it's not just, Taken or these other movies that we see.
That's a very good point. We're getting some comments that that was very important to bring up, because it could take a while. It's almost like you're saying, if it's someone that's close to you, it's not going to happen right away. They're going to lure you into feeling comfortable and feeling trust in that person. So thank you for bringing that. We're going to go back to Noah and Aaliyah. How can art therapy help a victim recover and restore their lives? You guys are involved in art. I know, Catherine, you mentioned as far as journaling. what can you guys share as far as just art being a therapy to help others recover?
Well, awesome. Thank you. Well, I can't speak as a therapist or therapy, but I know that art has this therapeutic healing effects and healing powers. In fact, we worked with a nonprofit called
Warriors
in Art, and Mike Reynolds, who started the nonprofit, is a Marine Corps veteran of 12 years, multiple deployments, survivor of multiple, explosions. And when he was in Walter Reed Medical Center, rehabilitating himself after suffering an IED, a trauma, he basically found that art was the only way. He did an exercise with a therapist and came back and says, okay, that was the greatest thing that ever happened to me. How I want to do this again.
Let's do the next lesson. And the therapist said, no, that was just like one lesson. We're moving on to something.
It was just an exercise.
And so he just started exploring that avenue more, and he was able to kind of express himself through his artwork. And it was extremely therapeutic to him. And, that was, I think, one of the things that we've been involved with, or, that just really opened our eyes to firsthand to how art can be therapeutic for someone.
And me personally speaking, I suffer from PTSD, and, it's just one of those things that happens. And art, getting into the zone, figuring something out when you have a problem and you conquer the solution and you create something, that's my mountain that we climb, and we are able to plant our flag and move on and move forward.
Thank you so much. We have a comment here for Dr. Mollie Gordon. What is the process when someone goes into Bentop to get help? What's the first step that they need to do to get help?
That's a great question. I'm going to actually pull up I should have this memorized, right? I was going to pull up our cell phone number that will activate. I'll pull it up for you guys, our consult team. So it depends on where the person is receiving services, is sort of the general answer. So if a person is in the community at one of the Harris Health, I think there's 27 now, Harris Health community clinics, then they can, and they know that they have been trafficked and are seeking services specifically to address those needs, then they can ask their provider to connect to our team. If the patient may not know that they have been trafficked, or when they have a healthcare need, they can always come to our emergency room for mental health evaluations, for if there's a mental health crisis, for emergency medical services, and emergency surgical needs. If the patient is not in medical crisis or in urgent care, then they can contact our anti-trafficking team and make an appointment with a mental health provider. And then that mental health provider and then our social work team will assess whether or not that person needs to see a primary care doctor or has surgical or other needs that need to be met. And so about 30% of our clients are seen from the community, and they come to us that way. And about 60 to 70% of our patients are identified in the healthcare setting, and then referred to our trafficking team from providers. So the telephone number is 713-397-1785. And that's a cell phone that our anti-trafficking team carries with them. Again, it's 713-397-1785. Or a person can email recognizeht, which stands for Recognize Human Trafficking. So it's recognizeht@bcm.edu.
Thank you, Mollie. If you can put that on the chat as well,
Sure.
that for people that are watching on Zoom. We're going to go back to Miss Cathy McGibbon. How did you get out of your situation? Can you give us an example of just, at what point were you able to get out of that situation, and how? I know you talked about a little bit about it, that journey of emotional healing, but when did you feel that you were starting to heal? I know it's a process, but at what moment you felt like finally I'm moving some steps forward?
Yeah, that's a big question. Two questions, right? So the first one was the exit. Actually, that was actually due to, you know, we're talking about mental health, but honestly, that's how I kind of aided in my exit. Because one of the individuals that was trafficked with me, she started to have some kind of episode. She had a history of mental illness. And so she had an episode one day, and it was really bad to the point where the trafficker could not handle her. And his idea was, you know, hey, we were not in Houston, we were in Dallas. And so his idea was, you know, let's just get her into a hospital and let's just leave and we can go work and then we'll come back for her whenever she's ready. I took that opportunity, and it wasn't anything planned out. It wasn't anything that I, you know, was waiting for. It was just because out there, you're just living in the moment, right? So that moment just happened to come. And I took that opportunity to say, hey, let's get her back to her medical team in Houston, because she had, you know, doctors, and because she had a history, there were, you know, there were people that were familiar. Her medical team was familiar with her history. And so I said, let's get her back there. They know her medications. They know what to do with her. They're familiar with her. So let's just go there. And surprisingly, like, he listened, and he went forward and he was like, okay, well, let's just do it. There's one caveat in that, is in that they had a child together, right? So that kind of saved me as well, because if it had been some just random person that wasn't that he didn't have an emotional connection with, it would have probably turned out really bad. But he went for it. He did. We got back to Houston. And then, you know, because of, I didn't struggle with, I didn't have a history of mental illness. At least I didn't think so. But when I got back to Houston and I started seeing like familiar things, like familiar neighborhoods, when I walked into a hospital, it was just too normal, because my life before then was completely turned upside down. And so I was just living in this facade. But when I got back into familiar territory, I myself that trauma just started to regurgitate. And like, so I myself had an episode, and that triggered him. And to the point where he was just like, I'm exhausted, call somebody, I'll get you in the morning. And he let me go. He let me go with my brother and my sister-in-law to come pick me up. His plan was to come back and pick me up in the morning. And he knew that, you know, he was going to be able to do that because he had me in the palm of his hand, but he underestimated the power of my support system, which did not let me back. So they didn't even know what happened, but they were just like, you're not eating, you're not well, we don't know what happened, you're not going back with him. So that kind of got me out, right? And then after that, I would love to say, oh my gosh, I was saved, I was rescued, and I never looked back and my life changed forever. But that wasn't it. It took years after that. And literally, you know, even with him contacting me after I got away from him, I didn't see another choice. Because my identity was so stripped, like I was trying to get back to him in my mind. Like I was scared of him. It's hard to explain. I was terrified of him, but he was the only person I knew, because I was so disassociated with reality. Like I was so completely broken down. And so it was a process. When that healing and that aha moment came, I can't really tell you. I just know that when I started doing this work is when I started to realize, oh my gosh, like I have a voice, I can like help somebody. And so the more people I started to help just simply by sharing my story and then getting involved in doing some actionable work, right? That's when I realized I think I'm getting better. So there wasn't a moment where I was like, I'm better, but
Right.
but I can definitely say when I got involved and started giving back. But that was my process of healing. It looks very different for everyone else.
So this is a question as far as how can the community get involved, or how can the community help spread awareness on this topic? Anyone can kind of answer this, because I think it's very important for, you know, the education part of it, but also how can we continue besides, you know, like yourself, Miss Cathy, as far as sharing your story, what else can we do as a community to either bring attention to this topic or just continue kind of spreading that awareness?
Cathy, do you want to start with that and talk a little bit about your work and your relationship with the community? I'll hop in, and I'm sure others have ideas.
Okay, yeah, I was waiting on you. I was going to follow your lead, but I'll start. My number one thing is partner with survivors. That's where I would start, because I just believe that, you know, by giving the platforms and allowing survivors to use their platforms and their voices to give back into this, those who want to anyways, we really need to hear from them because they have like precious intel, right? Without like the survivors of this thing, it's kind of like we wouldn't know where to start, right? So that's the one thing that I would start with. And then get to know your anti-trafficking community. It is so important. Everyone can do something. Everyone has a solution within them. I often say that you don't have to be a Mollie Gordon. You don't have to be a survivor. You don't have to be a law enforcement to get involved. Literally, you can get involved with your anti-trafficking community, pick up the phone and say, hey, what do y'all need? Like, or what is this thing? I guarantee you, they will be more than happy to educate you on ways that you can get involved. If you're good at fundraising, these nonprofits that are struggling and these agencies that are trying to stop and end this thing, they need money. If you're good at, cooking, there are agencies that do direct care services and they need folks to come in and teach overcomers how to cook. Everyone has a solution within them. So I would say you take the step of, take the leap of faith and don't be scared because it's trafficking. I have nothing to give. Everyone has something to give. But first you have to, this is good, right? Because we're starting with awareness, but you have to educate yourself. And then we have to look at the entire picture, the prevention, right? And ending the demand and helping survivors. It's this whole big model that we have to like tear down, but everyone has a solution within them to join the fight.
So I would echo what Cathy said.
Wow.
Absolutely. Oh, go ahead. Do y'all want to go ahead?
No, please, doctor.
So I was going to echo what Cathy said, which is number one, to educate yourself about trafficking. SOAR, which is the Stop, Observe, Ask, and Respond training program that's put on by the Department of Health and Human Services at the federal level by a group called NITAC, NHTTAC, through the Office of Trafficking in Persons, has a free 30-minute and 1-hour education sessions that you can listen to while you're taking a walk or in the car. And those are evidence-based education and training programs. So educate yourself, educate the people around you. So awareness of trafficking is really the first step. The City of Houston also has on their website and through Menal Davis, their advisor, a list of partners who have established relationships at the municipal level and with NGOs and with the healthcare system. So there are plenty of organizations that would definitely benefit from volunteers who, many of whom do excellent work. If you are very involved in your church, there's the Freedom Church Alliance. The Houston Health Foundation supports our work fiscally. So there's definitely lots of opportunities to be involved and give back to the community in lots of different ways.
Yeah, thank you. Catherine and Mollie, excellent. When we were asked by the council member to get involved, we were like, well, how can we really, have an impact? And, when even when we received negative press of, how is that helping? When there are real programs that are being implemented and boots on the ground. And well, you know what? We know that our small, minute, little project, if it can have an effect or give awareness to it, that's what we did. And I think
so I do think that we did achieve the mission of bringing awareness to it, because we did have, it wasn't that the media attention was negative, the media attention was positive.
Perfect.
But you know how people will comment on news stories, and you always have the negative people, and they're like, oh, how's this going to help? And yeah, of course, we're not saying we're going to help solve the problem with these boxes, but hopefully, even if it can just help one person, then I feel like it's a success for us. The fact that we were able to get on the news and talk about the issue, and talk about the phone number to call, the national hotline, again, just with a simple act, you can help get the word out.
Yeah, and I've been painting murals and been and creating murals for a while, and we created a mural of Bissonnette with our partner, the Salvation Army. I've curated murals all over North America, and doing so, we work in underlying redline communities, which are let's just say wrought with social and economic issues. That this is a dreadful common place, but in our society. And what we want to do is, yeah, we don't want to blatantly say stop human trafficking that's happening here and bring, because I visited all 4 or 5 locations that we painted mini murals for, and I have to say there were locations that I wouldn't take my children in the daytime, and so I felt that other Houstonians, I come home with the weeping heart, and knowing that my children, and how this can happen to anyone in any social demographic level. But it's unfortunate that in these areas we were able to help bring a small awareness, and at any level. I want to echo everyone's message. If you can't get out there, and you at any level, please get out there. I happen to be a Knight of Columbus, and our mission, is to help our family, our church, and our community. And that's why I believe that, Upright Studio, our mission is driven, for, civic pride of civic art, and educating, moving, and engaging people through public art. And I hope that, in one small way, that we've been able to help through this project. And thank you so much. Again, educating oneself.
And I just want to add to that commentary that not all of the locations, it's obvious that that's what's going on. And it's just like, once you know that that's what's going on there, then you're like, oh, the signs were there and I didn't even really realize it,
Right. We have a comment here as far as stigma. I know we always talk about, mental illness and just mental health in general always kind of has that negative stigma behind it. Does this issue also, does stigma still affect this issue in your experience? What do you guys think we can do besides the education to really kind of break down that stigma that might have some individuals not speak up or get help? How can we help those individuals when the stigma is there?
I may speak to that. So I think that there's going to be stigma about all sorts of things, whether they're positive and negative. People will pass judgment, unfortunately. Some of my thoughts about stigma in particular are responsibility and blame. Oftentimes, healthcare providers, the community will blame a person who's a victim of trafficking for doing things that make them vulnerable to being taken advantage of or harmed. A lot of victim blaming can occur. And I think of trafficking from what we call a socio-ecological model, which means, yes, there's individual risk factors, but trafficking is a social issue. It's a social problem, and we're all responsible for it. So if an individual is vulnerable, that's because we as a society are allowing those vulnerabilities to exist. And so if we universalize an understanding of trafficking as anybody, like Cathy said, can be vulnerable at an individual level or at a community level, that the mechanisms by which traffickers coerce and psychologically manipulate their victims, at least in the healthcare literature, are on par with the same forms of exploitation that torturers use in wars. So this is not something to be taken lightly when we think about the sorts of harms that come to people who are victims. And I also think that, unfortunately, mental health still does have a stigma, but if we universalize mental health as an issue that most people will struggle with at some point in their lives, I would hope that it gives us a level of empathy and understanding of the victims of trafficking, that we can somehow humanize their experience and understand that they too were harmed or even needed a doctor, even at that level, So for as much as we think we don't have in common with victims, I think that we'll find as we work in the space that we have more in common with them than not.
Yeah, thank you for that. We have a comment that came through the chat. How can nurse practitioners in primary care make a difference? Second question, how can we integrate content in curriculum?
So as I mentioned, there are SOAR trainings that are available through the federal government. The Texas Department of Health and Human Services passed a Senate Bill 2059 that now requires all licensed healthcare professionals who are renewing their licenses to get an hour training in human trafficking. We have applied to be a trainer, our team, to meet those requirements. And so what I would do is reach out to our team. We provide trainings either in person or online now. Actually, it's one of the maybe the only good thing that has come from COVID is our availability to connect to people through technology and reach more people through Zoom and webinar platforms. So we'd be happy to do trainings. We'd be happy to encourage you to connect to training opportunities. And then at a curriculum level, there are nurse leaders at the American Hospital Association and at the federal level who have developed curriculums that can be shared in nursing schools. And if you email me directly, I'm happy to connect you to those resources.
That's wonderful. That's wonderful. This question is for Dr. Dr. Mollie. You mentioned earlier that addressing human trafficking as a team approach. What compromises your team?
I was answering the chat too. Okay, so our team is what we call a interdisciplinary team, meaning there are mental health professionals. So there are both psychiatrists and psychologists who make up the mental health arm of the team. We have a clinical case manager. We have medical doctors, surgeons, social workers, chaplains, nurses, occupational therapists, and I feel like I may be missing one, a pharmacist. So it's a very large team of persons. And so it's not just me, it's not just the mental health arm. It really is an integrated model of care that makes sure that the patient's medical, psychiatric, and social service needs are all met. And if we can't meet them on our team, then we partner with folks in the community, folks in law enforcement, folks on the prosecution end who are able to meet those needs.
Thank you for that. We have a question for Noah and Aaliyah. Where can we find these murals? I know you guys mentioned the 4 locations, but you guys want to share the article on your website where we can tell the audience specifically where they're located?
Yes, well, we have them on the Mini Murals website, but I don't know if they're clearly marked. So I would be happy to type in the locations into the chat box.
Okay, perfect.
And also, if you go to HoustonMuralMap.com, we're going to be creating a page specifically for these mini murals.
Yes.
Okay, perfect. We have here from Nicole Franklin. I work for aid to victims of domestic abuse, and we provide education to adults and youth. How can we be of a support?
So that's AVDA. We're very familiar with their work. You guys do great work. Thanks for being on the call. So there are a few different ways that you can be of support. My first thought is to connect to NGO partners in the community, like Cathy's group and other folks, as I mentioned, who are connected with the city of Houston to see if there's anything in particular that they need. From our standpoint, it sounds like you aid victims of domestic abuse, and a lot of victims of domestic abuse are also victims of trafficking. I think sometimes we separate those, and it really is a Venn diagram. There's often an overlap, and as Cathy mentioned, it's usually somebody trusted or sometimes even a romantic partner that exploits another person. So feel free to reach out to me via email, and I can connect you to our clinical case manager. And we have other partners in the domestic abuse space that we work with that we'd be happy to get on a call with you to discuss further. And we'd also be interested in educating adults and youth. And actually Cathy can also partner with us in doing those sorts of things for outreach. And so there's plenty of opportunities for partnership and to get involved in the space.
Yeah, and I want to piggyback and say that that's super, I'm glad that you asked that question because a lot of times victims of trafficking or survivors of trafficking won't identify as trafficking victims, but they will identify with domestic violence. So you'll probably see them before we do, right? So that's a really important question, and Mollie answered it great, but thank you for asking that. That's critical.
Going back to you, Catherine, you tell us about your involvement and how people can get in contact with you, and then any type of positive story that you would like to share as far as just the women that you have met, something that maybe you learned, just from listening to their story, if you would like to share anything that you could share.
Yeah, absolutely. So I have founded a nonprofit called 1211 Partners, and we come in for the continuum side of it. So there's like a timeline when victims and survivors exit the life, and then there's this timeline that they go through. A lot of times they're going to emergency assessment, and then they go to housing or residential treatment or whatever, right? And then they get to graduation. So they've completed their programs and they're wonderful, and we're all celebrating them, and it's great, and they've learned all these awesome skills. However, when they get into like real life, they're like, okay, how do I apply these skills? Like, this is real life. I've never paid bills before. I've never had my own house before. What does that even look like? So that's what 1211 Partners comes in. We partner with individuals that have survivors that have gone through programs, or individuals that don't want programs. A lot of people just don't think that programs are for them. So we do that through three things. Mentorship, which is the meat of our organization. It's so critical that survivors have community. So we provide community through mentorship. We've created mentor circles, and then we also provide career path development and housing referrals. So just very practical, straight to the point things that we do. And we're always looking for mentors, right? So if anyone has a desire to work directly with survivors who are on their way to thriving in their independence, I would love to connect. A really good positive story just from doing this and from partnering with survivors. It is amazing to see the transformation from especially when you've walked with someone from the time of their exit to the time like they're buying their own house. It is crazy to see. But I think that more people need to hear stories like this to know that trafficking can truly end. Yes, I believe that trafficking can end because it ended for me. So if it can end for 5 more people and then 100 more after that, then we are ending trafficking for individuals. There was a comment that was shared with me, and it just made me cry. It just brought tears to my eyes, but it's a happy story. She was like, when I first started with you, I didn't know my purpose, or I didn't identify my purpose. I didn't know where I was going. I didn't know what I wanted to do in life. But now I feel like I'm taking ownership of my testimony, of my story, and I found my purpose, and I can do life now. That small little story, it may seem very insignificant to someone, but that is a huge testimony and story for survivors, someone that have survived trafficking. And trafficking is big, right? We have the definition you heard, we explained what that was, but a lot of times people don't understand. From the survivor's perspective, trafficking is so much. It's more than just the label, where we have to do so much, and it's so much trauma and so much pain. So to hear the story of overcoming, to hear someone say, I found my purpose, and I'm owning this thing, that is what I would love people to hear. And that's kind of what I want to, I hate to leave the picture of this dark like problem. Yes, it's dark and we got to fix it, right? A lot of other things we got to fix too. But I really want to leave you guys with the story of overcoming, right? They went through this, and this particular individual, she went through some horrible crap, right? Since she was little in her childhood. And now to hear her say, I found my purpose and I'm owning this stuff, it's amazing. So keep that story in your minds and know that it can end. Trafficking can end. It can end for one person. It can end for 1,000, but it can end.
That's beautiful. I also want to share the National Human Trafficking Hotline, 1-888-373-7888. We had a few people that was asking as far as the national hotline. We also have a question back to Noah and Aaliyah. How did the studio start? And how long has the studio been part of Houston?
Wow. Well, thank you for that question. So how did the studio start? The studio started out of a generous donation of a patron of ours, of mine, who was a believer, and then we then provided in 2012 is when we opened the doors of the studio at Maine and Aurora in the Heights, and that was our first studio space, working out of donated spaces. And we then proceeded to, I guess now it's our 8th year, and utilizing that platform, it gave us the
the experience and the to get us to where we are now. Now we're a creative consultancy company, and
we manage and operate, our programs for municipalities, like the mini murals program, for instance. And again, our that helped us. I'm sorry, I'm being long-winded in my answer, but the truth is, we believe in our mission of civic pride, of civic art. Where we really just want to make Houston beautiful.
We want to add color to underserved communities. There are so many in Houston. Before the mini murals program came along, there was very little public art outside of the Loop. And so with that program, now we have 300 diverse works throughout all of Houston, not just in that area. With the pilot phase alone, we brought in 31 boxes to the area called District K. And before that, they had one piece of public art, and it was a portrait of someone in a library. So, the fact that we're able to provide art for the public,
for the common man.
Yep, because it's like, not everybody can make it to a gallery, or maybe is not comfortable in a gallery museum setting. And so being able to provide public art to these communities, often communities of color, often communities with challenges, I think that's really what drives us to do the projects that we do.
Art everywhere and for everyone.
That's wonderful. So I'm putting on the chat and on the comments, people are asking kind of your contact information. So we'll start with Cathy McGibbon. We put the website there. The website is www.1211.org, and the word 12 is spelled out. And then her Instagram handle is 1211, number 11, partners. And then for Noah and Aaliyah is going to be Up Art Studio. It's the Instagram handle. And then the website is
upartstudio.org.
upartstudio.org. So for everyone that's asking, you can get more information on how you can get involved. We also put Dr. Mollie Gordon's email. Anyone that has anything after the Tuesday Talk Lives, you can just leave your comment on our Facebook Live, or just email us directly, and we can definitely address any other questions that you guys may have. So like I had told the panelists before we started, the last kind of few minutes of the Tuesday Talk Lives, I always like to ask, as far as just mental health in general, what are some activities that are positive mental health that you guys, maybe a ritual that you guys are doing now or continuing doing? We'll start with Noah. You were anxious about that.
Yes, I'm super anxious. So
mental health ritual. What's your positive?
Well, recently, I've discovered the benefits of catching my breath, and that's through meditation. And Ellie and I, we have, we're like, oh gosh, what's our definition of healthcare, and like,
self-care.
And self-care. We're like, I don't know, but being able to, catch our breath and to be able to, look, this year has been an amazing year. And I say that, and, not to say it's been a dreadful year for America and the planet Earth itself, but we have the opportunity to be grateful that I'm blessed to be with our dog and our 2 children and our company that's able to create
a sliver of happiness.
And again, that's something that I'm 44 years old, and it's taking me decades to realize that I'm actually pretty happy. And in order to be that, I just mindfulness, learning to be mindfulness, and it's taking me a while to do that. So
cheers to getting there.
Cheers to getting there.
Dr. Mollie Gordon, what's your mental health or kind of positive ritual that you keep your self-care up?
Oh, that's a good question. So I think definitely working with a team and sort of sharing the professional, what we call vicarious trauma that can occur to those who treat victims of violence is really important. So I definitely lean on my colleagues tremendously and have a wonderful group. So that's very important. And then I'm a maker and a crafter. So one of the reasons I really like the mini mural project is because for all the terrible, ugly things that have happened this year in the world, I feel like they're sort of undoing that by putting beautiful things out to sort of counteract that karma. And so I'm in a group called the Physician Mom Crafter Group, and we get together online now because of COVID, and try to make things that put some beauty back out into the world. And so that always feels good.
Wow, that's awesome. Thank you.
What's one thing that you have created and crafted and just been proud of? Is there something that's challenging for you, or you just kind of, your creative ideas just come?
So I don't know if do I disclose this on Facebook? But I've been working on what we call bling taxidermy. So taking taxidermy, and we're doing decoupage and gold leafing and rhinestonings and lacing. So that's been really fun. And then this last week I had a class, one of my colleagues who's a psychiatrist up in the Woodland, led a class on card making and paper crafting. I do not have that skill set for very tiny, small, measured things. I'm definitely a big concept maker. It was fun, but it's very hard for me.
That actually sounds like a lot of fun. And then Catherine, anything that you would like to share as far as your self-care and a kind of a positive ritual that you work on?
Yeah, so several things. I found the power of the off button. So I will literally turn off my phone, which is amazing. It's crazy to do, but I literally walk away from it. And then I'm paying attention to my Apple Watch. When it tells me to breathe, I'll literally just stop and throw everything and just breathe and start breathing exercises. And then faith and family for me. So is huge. Like that's my thing, faith and family this year. So we'll just do spontaneous things. We'll go out in the backyard and just be crazy. I love to play pranks, and unfortunately my husband is the receiver of that. So so just being intentional about like inserting bits of joy everywhere and every chance that I get.
I'm sure your husband can share a lot of prank stories that he's your tester. Before we go off, what is it one thing that you guys are looking forward for 2021? I know we're still kind of new into the year, but if you can just kind of name one thing that you're looking forward to, what would that one thing be? Noah and
Okay, of course. I know. I'm shocked. What am I? Well, I like to think of the Renaissance of what's to come. I like to think that after the Dark Ages, after the plague came the Renaissance, and in a great age of science and technology and art and creativity. I'm simply just caring and looking for the Renaissance that's to come.
Beautiful.
I love that answer. I'm not going to be able to top that. I was thinking like go out to dinner in person. I was like much more, much more simple.
Do you have a favorite food of choice for you, Dr. Gordon?
Oh, anything that's not outdoors in the Houston heat. So I was to eating at a restaurant in the air conditioning, as I would say that. And then, I would echo what was said about, maybe if this has been a traumatic stress for all of us globally, maybe there will be some form of growth. If we think about it in sort of a global level, that maybe the world will move forward from this and be better off
the Renaissance
where we began.
I love it.
Last but not least, Catherine, anything you want to share?
I'm looking forward to traveling again. I have like a list of places that I want to go, and I'm like, please, I just want to travel again in person. But I'm also looking forward to growing our survivor community. I know that's weird because I try to like separate work from doing life, but for me it's like doing life. Like I love to see our survivor community grow into leadership, and so I'm excited about that. I think by the end of the year we're going to have like this big old group of survivor leaders, and we're going to be like, yeah, we made it. And so I'm looking forward to that.
That sounds amazing. So we want to thank all our panelists today. I think we had some beautiful but necessary discussions when it comes to human trafficking. If anybody has wants to share this, it would be up on our Facebook Live. We can also have any comments or questions. If you guys go to our NAMI Greater Houston Instagram, it's just nami.gh. Any comments or questions there that you might want to share, our panelists are tagged on our flyer, so you can also reach out directly. But once again, thank you so much for joining us on our weekly Tuesday talk. It's at 4 o'clock. So next week, join us for our next panelist as we start a new month. So I want to thank you to everyone. This is wonderful, and hopefully we'll continue the conversation later on.
Awesome. Thank you for
Thank you for
having
having
us.
us.
Thank you guys. Have an amazing
much.
Tuesday.
Awesome.
Thanks. Bye, everyone.
Bye,
Bye.
everyone. Cheers.